Hey, Dr. Bob here with Active Life Chiropractic, and I want to address some of the most common questions or maybe concerns that someone might have before they visit a chiropractor. And so number one is going to be, once you go to a chiropractor once, you have to keep going in forever. And where that comes from is, well, let me start off and give you a couple of examples. So number one would be, let's say someone comes into my office and they have a history of headaches. So maybe they've had headaches on a weekly basis for the last 20 years. Now, more than likely, if I work with this person on one visit, their headaches are probably still going to be there. They might notice a small amount of change, but it's not going to be, this miracle, life-changing event that they're like, I went to this chiropractor and he adjusted my spine and my headaches went away. More than likely, if someone's had headaches for 20 years, they're going to need a series of treatments. Now, at least in my office, my initial exam lets me know what that process looks like. So it lets me know how many of these treatments do we need, and then how much is it actually going to help? So is that going to maybe work on eliminating the headaches completely, or is it going to, maybe reduce headaches that are on a weekly basis to a monthly basis? Can I get you 50% better, 80% better? So I set expectations with this time frame, and then it lets me know what that time frame looks like. So my initial exam will show me, okay, this is going to be a 2-week process, a 4-week process, an 8-week process, whatever it might be, and that's it. That's how we're going to correct it. Where the myth comes from that you have to keep going in forever is that a lot of patients will use chiropractic as a form of healthcare. And when I say healthcare, it means that they're maintaining their spine and they're not just waiting for problems to show up. So like, for example, we all know we should go to the dentist twice a year, whether you feel pain or you feel like you need to or not. We just know that's a good practice. We all know that we should take our car in for service, routinely, instead of just waiting for problems to show up. So wellness or prevention is another aspect of health, because when you look at your spine, it's so complex. It houses your nervous system. There's so many joints. We all know people that have had bad backs and bad necks, and they're 60 years old and they can barely walk and they can't really do anything anymore. And a lot of people don't want to end up like that. So they'll come to me for maintenance care on, let's say, a routine basis before they notice symptoms, and it's more or less just a tune-up on their spine. It's like getting an oil change for your car. But from the outside looking in, somebody will say, okay, maybe it's like friends or family members will say, you're always going to the chiropractor, it seems like, maybe they're not fixing your problem if you have to keep going back. When in fact, maybe their headaches were taken care of, maybe their sciatic nerve pain went away, and now they're just maintaining it, and a lot of people find value in that. So I feel like, that's where that myth comes from. And then the second thing that people are concerned about, or if you Google chiropractors and you're looking for, what are the risks, what should I expect, what are the horror stories with chiropractors, you'll come across the first one that I just mentioned, and then you might come across safety. So there's a lot of myths out there about the safety of chiropractic care, and can you injure someone, can you cause a stroke, can you herniate a disc, and all of these different things. And like I said, my initial exam shows me, what your expectations should be moving forward, how much I can help. But it also lets me know if there's any risks associated with it. So you can always tell the risk associated with something based on its liability. So for example, when you look at malpractice insurance, my malpractice insurance is around $1,000 a year. There's some doctors, specialists out there that have, very risky jobs doing surgery. Anesthesiologists, OBGYNs delivering children, delivering babies. It's like $30,000, $40,000 a year for their malpractice because the risk is huge. Chiropractic care is considered more of a conservative style of care. And as a matter of fact, for me, I actually spend more on my auto insurance than I do on malpractice insurance. So I'm more of a threat on the roads than I am in my office. And the initial exam that I do lets me know that things are okay to work on. So if someone's having really bad sciatic nerve pain and it's going down into their leg and they had an injury, rather than just lay them down and adjust them and go in blindly, my exam's going to show me, like I said, the time frame for healing, for feeling better, expectations, but it's going to let me know that everything is safe to work on. So hopefully you got some great information from this video. If you feel like you'd like to schedule an appointment, feel free to call our office at 980-406-3862. You can also schedule through our website. It's www.activelifenc.com. You'll see a link at the top of the page that has a calendar. You can actually schedule appointments that way. And be sure to check out my blog while you're on there. I have a ton of information and wellness videos on how to create a long, healthy life so that you feel as good at 70 as you do when you're 20. So be sure to check that out. I feel like I have some great tips on there. And feel free to reach out if you have any questions, concerns, or comments.
For more health tips, strategies, and random facts about us, follow us on Facebook, YouTube, and Instagram.